Brain surgery is always a high-stakes operation.
Looks good.
That mysterious gray universe inside our skulls is a labyrinth of tricks waiting for even the best neurosurgeons. Two of those skilled doctors, Kelly Foote at Shands Hospital at the University of Florida and Ali Rezai at the Cleveland Clinic, are now beginning a revolutionary experiment in psychic surgery.
That's a picture of Cindy's brain and scalp, three-dimensionally. That's our approach.
Dr. Rezai's patient, Cindy, has been suicidal with deep depression. Dr. Foote's patient, Kelly, is an extreme obsessive-compulsive who cannot leave her house. Through nearly identical surgeries, both women's conditions will attempt to be treated by implanting electrodes inside their brains.
You can see from the front view, that's the electrode going in, one on each side.
So the phrase deep brain stimulation is very accurate. This really is a deep portion of the brain.
Deep portion of the brain. You can see here's a three-dimensional reconstruction where the actual path of the pacemaker implanted the area involved in mood. And this, you can see it here also in the skull X-ray. Here's one electrode going down, and this is another one. It's got 4 contacts.
Where's your anxiety right now? 5, 8. Okay.
Both Cindy and Kelly are awake during their 5-hour surgeries. They need to be, because their responses to the surgeon's questions will determine if the electrodes are being precisely placed in the brain's mood centers.
Okay, now we're going to stimulate and test you, okay?
Now, low volts of electricity are applied along the contacts. Watch Cindy's face and expressions.
That a smile? Definitely.
I was laughing, and I can remember feeling in surgery like, wow, you know, if they can make me feel this way, you know, this might work.
It was that dramatic. I mean, you felt.
I just felt like smiling and laughing.
How's your energy level?
Do you feel like you have energy?
Yeah.
Yeah?
Suddenly you got reconnected to the world.
Yeah, it was like that.
But when voltage is applied to a slightly different location, tears.
Hang in there.
I can remember crying, and I could tell by my face, you know, I was starting to look sad, and it was kind of heartbreaking.
Then another spot just a few millimeters away, and more laughter.
There's that smile again. Definitely better.
It was really amazing.
And that was obviously not a feeling you had had for a long time.
Right. Years. Years.
Like Cindy, Kelly's surgery triggers a nearly instantaneous reaction.
Do you feel anything? Feel funny there?
It's just a wave. It's kind of like if you were to put happy gas on, I guess. I don't know. But it's a wave that comes over you.
It's a really weird thing to see, you know, I could turn a switch and she would be happy. And I would turn a switch and she would be back down to normal.
Do you think something's funny, or do you just feel like you need to laugh?
They can make you feel calm or sleepy. It was pretty unusual, but exciting because I felt like it was going to work.
But generating emotions in the operating room is not the true test of this medical trial. That will come later when Cindy and Kelly return to their normal lives and the electrodes placed in their brains are permanently turned on. To do that, the surgeons still must implant a pacemaker to power the electrical signals.
This is the pacemaker battery, and it's got a little chip in there that you can program externally.
Is this the same unit that is in Cindy?
Yes.
Including this is the electrode end, right?
Right, that's the electrode end. It's got 4 contacts, and you can activate each and every one of those contacts.
So that goes into her brain,
Yes.
comes out through a tiny, tiny little tunnel,
Yes.
essentially, then is clipped on, permanent, anchored at the skull.
Correct.
Then this what, goes around or something? How does
It goes
this work?
around behind the ear,
Yeah.
and then it gets implanted in the chest, just like that. Right under your collarbone, like a heart pacemaker. We're all done.
We are done.
As the surgeries end and the stage is set for the next step in the experiment, it's important to remember that medical history is littered with encouraging tests but failed results. Attempts to manipulate human behavior through brain surgery has an especially checkered, even shameful history.
The surgeon inserts the leucotome into the brain.
Lobotomies, for instance, were once hailed as a breakthrough technique to reduce violent behavior. only to be abandoned as grotesque mistakes.
I would have to assume that you all work in the shadow of those lobotomies and the stain that cast across the medical profession.
Absolutely. It's slowed down the surgical approaches to help psychiatric patients for 20, 30 years.
Lobotomies, says Dr. Rezai, destroyed large sections of the brain, sometimes leaving patients, like the one played by Jack Nicholson in the movie One Flew Over the Cuckoo's Nest, as emotional as shells.
Now the difference is that the techniques have evolved dramatically, so we've gone from an area where we're very grossly understanding where the problem area is, and we've fine-tuned it to a specific pinpoint area.
The fine-tuning of Cindy and Kelly's brains is about to begin as their pacemakers are turned on and they hand over control of their emotions to their psychiatrists.